We just had a YouTube viewer ask us, what should they do if they're not quite ready for a rhinoplasty now? Can they get injectable fillers and then have rhinoplasty down the road? Is there going to be any impact?
That's a more common question that we're getting as the years go on. I think maybe that's been something that's been happening for about 7, 8, 10 years now at this point. Generally speaking, you know, we're not the greatest and biggest fans of using fillers in the nose. We think that for the large part, especially in a primary setting, the aesthetic doesn't usually make sense. It doesn't usually make sense to put fillers in. However, where there's just, you know, a little bit of a low radix or something like that, where you're filling in that area, it can give you a view of what's possible. But in general, most patients in our experience are looking to get their nose made smaller, and so in that sense, the fillers don't seem to make a whole lot of sense for us.
Yeah, I mean, they make some sense for people who are looking for volume, who are looking to make the bridge of the nose higher, that type of thing. And in those cases, there really is no issue with going ahead to do filler ahead of a potential rhinoplasty procedure, so long as you understand what the limitations are. Filler in the nose can last sometimes a year or longer, and you have to have a good discussion with whomever is planning to do your surgery about what the potential implications are.
Yeah, really important to understand this is all off-label stuff.
Yeah.
These aren't things that the FDA has approved. A lot of people have been doing it, so it is important to understand that whoever you are having put fillers into your nose has a lot of experience with this. You need to go over the risks and benefits of that. Surgically speaking, if you do have filler put in your nose and you come to, say, somebody like us and ask about surgery, generally we like to wait for about 6 months after the injection have been done so that most of it has gone away at that point, and we can get a better assessment of where you are preoperatively. That being said, most of the temporary fillers can come out once we're in surgery.
Yeah, it really just makes a difference in terms of planning. If your surgeon's not able to adequately assess how low the bone really is or what the nose really looks like when filler's gone, it can make surgical planning and what is done during surgery a little bit more challenging. That being said, revision specialists like us have a lot of experience going in, taking out filler if necessary during surgery, and then compensating for that with grafts or with other techniques. One word of caution, you need to be really careful about the permanent or semi-permanent fillers. The temporary fillers like hyaluronic acid, Restylane, and Juvederm are just fine, and they're fairly easy to take out. The more permanent fillers are often a much bigger problem.
Yeah, so that's really important when you're talking about putting things like Restylane, Juvederm. That stuff is sort of a gel, and in surgery we're able to see it and take it out. When you start putting Radiesse or any of the other fillers, that's not necessarily something that will come out, and we're not necessarily even going to want to go into a situation where somebody's had a permanent filler put in the nose. And another point, like you were saying, you know, typically speaking, when you're talking about fillers, you're talking about putting it over the bridge area. Be very, very careful around the tip. Usually it's not a problem, but occasionally it can cause skin necrosis and cause real problems. It can also cause sort of a chronic inflammatory red discoloration, irritation to the skin. So it's really important to sort of go over all those questions and understand all of that before you pursue this. In a revision setting, you know, we can also talk about fillers as well, and that's a little bit different.
Yeah, so if you're thinking about temporizing with filler before you consider a rhinoplasty, just keep in mind you want to go to someone who's very experienced with doing this in the nose because there are some special considerations, and you want to plan for at least 6 months to a year after the filler before you consider surgery.